Welcome for you on my channel. My name is xloay. Today we will speak about coronavirus live updates. Drug proven to reduce virus deaths, scientists say. Retail sales rebounded in May after a record drop in April. The number of U.S. inmates known to be infected has doubled during the past month, to more than 68,000. The virus flares in Beijing. Right now Wall Street's roller coaster ride continued, with the S&P 500 rising almost 3% after the retail sales report for May was stronger than expected. An inexpensive drug reduces virus deaths, scientists say. Scientists at the University of Oxford said on Tuesday that they have identified what they called the first drug proven to reduce coronavirus-related deaths, after a 6,000-patient trial of the drug in Britain showed that a low-cost steroid could reduce deaths significantly for hospitalized patients. The steroid, dexamethasone, reduced deaths by a third in patients receiving ventilation, and by a fifth in patients receiving only oxygen treatment, the scientists said. They found no benefit from the drug in patients who did not need respiratory support. Matt Hancock, Britain's health secretary, said National Health Service doctors would begin treating patients with the drug on Tuesday afternoon. The government started stockpiling dexamethasone several months ago because it was hopeful about the potential of the drug, Mr. Hancock said, and now has 200,000 doses on hand. Dexamethasone is the first drug to be shown to improve survival in COVID-19, said Peter Horby, professor of emerging infectious diseases at the University of Oxford, and one of the chief investigators for the trial, said in a statement. The survival benefit is clear and large in those patients who are sick enough to require oxygen treatment. Professor Horby said that dexamethasone should now become the standard of care in these patients, noting that it is inexpensive, widely available, and can be used immediately. Trump's rally on Saturday could cause a huge spike, Tulsa officials fear. Officials in Tulsa, Oklahoma, are warning that President Trump's planned campaign rally on Saturday, his first in over 3 months, is likely to worsen an already troubling spike in coronavirus infections and could become a disastrous superspreader. They are pleading with the Trump campaign to cancel the event, slated for a 20,000-person indoor arena, or at least move it outdoors. It's the perfect storm of potential over-the-top disease transmission, said Bruce Dart, the executive director of the Tulsa Health Department. It's a perfect storm that we can't afford to have. Tulsa County, which includes the city of Tulsa, tallied 89 new coronavirus cases on Monday, its one-day high since the virus's outbreak, according to the Tulsa Area Emergency Management Agency. The number of active coronavirus cases climbed from 188 to 532 in a one-week period, a 182% increase. Hospitalizations with COVID-19 almost doubled. There's just nothing good about this, and particularly in an enclosed arena, said Karen Keith, a Tulsa County commissioner who oversees the area where the rally is supposed to take place. I don't want people to lose a parent. I don't want them to lose a grandma. I don't want them to lose a family member over this. Ms. Keith said that the rally was likely to draw walkers and protests outside the Box Center, the arena where the event is planned. A large overflow crowd could be accommodated at a convention center a block away, where Mr. Trump said on Monday that 40,000 others would congregate for his speech. The president also said in a tweet on Monday that almost 1 million people had requested tickets for the event. Mr. Trump on Monday said that criticism of the rally was the result of the news media trying to COVID shame us on our big rallies. Conservatives have claimed the double standard around large gatherings in recent weeks after millions of Americans attended protests, often inches from one another, over the death of George Floyd. Thanks for watching. Today will be Speak.